My name is Christy Johnson, and for my career profile, I've decided to research the Child Life Specialist. A Child Life Specialist is responsible for helping a child stay in the hospital to be as pleasant as possible. For medical procedures, someone in this career would help a child by giving them emotional support and coping skills to help lower the amount of anxiety and pain they might be feeling because of their medical issues. If a child is having a surgery, before the surgery, you would give the child and the family a tour of the surgery center so that the child can feel comfortable in that environment when their actual surgery day comes. A Child Life Specialist is responsible to design and implement pediatric programs, therapies, and activities among the young patients. This might involve therapeutic play activities that help decrease pain, meet treatment goals, and teach new skills and shorten recovery time for the patient. Working with families to assist in caring for childhood hospitalization or disabilities is a major part of this job. Working with families includes helping brothers and sisters of the child with an illness or injury understand what is happening to their sibling. In this career, you rely on instructions and pre-established guidelines to perform the functions of the job and work under general supervision. Typically, you report to a supervisor or a manager. The educational requirements for this particular job is a bachelor's degree in child development, child life, family studies, and psychology. You don't need experience in the field or in a related area. Someone in this career will need to have knowledge of commonly used concepts and practices and procedures within a particular field. Some places prefer someone in this career field to have a certified Child Life Specialist certificate. Child Life Specialists work in large pediatric facilities as well as small pediatric units, and they often work in specialty areas like emergency departments, surgical and intensive care units, and outpatient units. You'll find many Child Life Specialists now working to help children in other environments such as outpatient care facilities, doctor's offices, hospice care, specialized camps, schools and court systems, and even funeral homes. Work hours can vary but are generally from 7:30 a.m. to 7:30 p.m. Late evening hours might be required if you're working in a special pediatric emergency room. And some positions require you to work weekends and on holidays. You'll be working with children and families on a daily basis, so loving children and being able to communicate with them on their level of understanding is a must. Some typical stressors that you might run into are you never have consistency. You will be working with new children and new families every single day with different issues. Having to help children who are ill, some of them terminally ill or injured, and seeing the toll that it's taking on their parents and it's taking on their siblings can be emotionally draining and stressful. You have to be able to stay positive and happy and understand the best way to communicate with each child and each family individually in order to give them the best care and comfort they need to fit their needs. The starting salary range with a bachelor's degree is $37,000, and with a master's degree and being experienced, it's about $47,000. The typical benefits that somebody in this career receives is healthcare coverage through their employers, dental benefits, and vision benefits. Some additional benefits you might receive are short-term disability care and long-term disability care, and also maternity leave. Some miscellaneous career information is if you're interested in this during high school, they recommend while you're in high school that you take courses such as a college prep course, food and nutrition, child development courses, art and fine arts courses, healthcare sciences, psychology, and a second language. Thanks for listening. I hope you enjoyed my video on the Child Life Specialist.